So I want to talk about shoulder bursitis. So what that is it's an inflammation of the bursa that's surrounds the shoulder. So what bursas are they're like sac-like fluids that prevent the friction between the tendons and the bones, and they allow smooth motion, and they allow just lubrication in between those tendons and in between the bone. So some of the signs and symptoms of shoulder bursitis is tenderness. So if you're pressing on it, you can feel pain. Second thing is if you're working overhead, you can't really do movements above your head. That causes pain. And the third thing is just having pain at the end of your range of motion. So those are some of the signs and symptoms of what a shoulder bursitis is. So some of the causes of shoulder bursitis is injury to the bursa, repetitive stress, repetitive motions above your head, above your shoulder. That's going to cause the bursa to be inflamed. And then poor posture. So poor posture, if you have this rounded shoulder like this, what happens is you don't allow a lot of movement in between the tendon and the bone, and the bursa is basically squished in between those two and is constantly being rubbed up against with the tendon and the bone, causing inflammation. So a few things you can do to help decrease that inflammation of the bursa. The first thing is you want to correct your posture. So I have a link that I will link up right here to my posture exercises to help improve your posture. So the second exercise is a chest opener to help create that the space between the tendon and the bone. So what you want to start off with is, if you kind of look at your posture, you're standing, your thumb should point straight forward. Now if they're starting to turn inwards, that means you have that rounded shoulder, and you got to work on your posture. So with this exercise, what you want to do is turn your thumbs as far back as you can, and at the same time open up your chest here. And when you're in this position, all you're doing is you're holding this position for 2 to 3 minutes. And just hold it like that, 2 to 3 minutes again, like I said, and after that you just relax. So with this one too, make sure you're not bringing your shoulders up like this. You're not shrugging your shoulders. That's incorrect. So make sure it's down here and your fingers are pointed back as far as you can. So this last one, you want to use a tennis ball. So this one is going to be stretching, and it's going to be working on your pec minor and pec major muscles. So with this, you're going to use the tennis ball, hold it against the wall, put the affected shoulder against it, but you're going to place this right in front of your pec muscles, okay? So where the muscle from your chest connects to the shoulder. So this is where, so with this, you're just going to press back and forth where it's kind of achy, where it feels sore. That's where you want to work a little bit more. And you're just going to do this for about 20-30 seconds, and then relax or move it to a different area. 20-30 seconds and relax. You're just going to work that for as long as it's comfortable for you, and you'll feel much more shoulder movement after this stretching. So thank you for watching. If you like the content and if you enjoyed the information that I've given you here, please like, subscribe, and share my channel. I appreciate it. And until I see you guys again, take care.